Harley Street for around 5-6 years now, and have been working for the last 2 years on Apex Medical essentially, and creating a way that people can get into longevity medicine.
And Dr Abs, tell us about yourself.
Hi, I'm Abs. So originally I started as a dentist. I don't do that anymore. I do quite a lot of different things now. I teach different subjects like medicine, dentistry, biochemistry and quantum physics, and I've worked around the world in lots of different things. Right now I'm also a consultant in biotech research as well, and we look into all sorts of things, but mainly mitochondrial function. And when you really get down to it and you look at what longevity is, what all-cause mortality is, where all diseases come from, all problems humans face, it comes down to that scale. So looking at that kind of scale is a really good perspective to then be able to translate that into clinical medicine to try and show you guys what longevity medicine is.
So I just wanted to check, there's a few of you asking about no sound. Just wanted to check the technical team speaking up a little bit louder. Okay, so why don't you just turn it a bit closer to the mics. Excellent, brilliant. So really grateful to have you on the journey. It'll be about an hour this webinar, and I'm going to be asking a lot of questions. My name is Dr Amrit, and many of you would have seen me on the Dell Medical online training videos and as well as webinars for live injecting. And as an aesthetic injector, this is a topic that for me is very interesting because I've got my own clinic, I've got a number of injectors in the clinic, I've got my own established patient cohort who are looking for aesthetic treatments or generally holistic treatments to look and feel better. Now, for someone who's already in the aesthetic space, there's no brainer. This is something that they need to consider to add into your practice. But for even those that are maybe practicing the NHS, maybe practicing traditional medicine, nursing, variety of other specialties, who exactly can get into this? Tell me about that. Is it something that specifically doctors and dentists or pharmacists? Why is the scope?
Yeah, exactly. So aestheticians are prime placed for longevity medicine because they've already got a patient base who are interested in looking good. So most people who are looking good, indeed a survey done by the British Association of Plastic Surgeons showed that 95% of people who look good and go to aesthetic parlours and salons, they want to feel good too. So they want to feel good on the inside as well as look good on the outside. So you've already got a great patient base there who are looking for these type of treatments to help age in a healthy manner.
Okay. Now I'm going to ask you quite a lot of academic questions shortly, Jan, so I can actually understand. I actually don't know what longevity. I'll be honest. Okay. To me, longevity is just a word that gets thrown around. So I want to understand a bit more about what different kind of caveats does that include, and what kind of patient will that be involved in. But starting with Matt, so I know you've already been in this field for a while now, and you've got a clinic and you focus on the whole holistic approach. So what kind of patient kind of comes in looking for these or advice or treatments or consultation? What is the process? If you're looking at it from a patient's perspective, because as a business owner I can kind of see who my target audience is, who is your classic patient?
It's a really good question because longevity medicine is such a broad topic. It can encompass anything, and people often say it's biohacking longevity medicine, are bioidentical hormones longevity medicine. What is longevity medicine? I think it's a great question and one to target before you even go into the type of patients. And longevity medicine is really the main aim is in order to optimise people's health so they live healthier for longer. And that's what it all comes down to. And you can take that in a multiple different tiered approach. So you've got to start off with diet, lifestyle optimisation. You've got to make sure that people who are wanting to feel good and continue to look good as they age, they've got to be doing the right diet. And you've seen that with your aesthetic patients. I'm sure that if people come into you for aesthetic treatments, you've got to talk to them about eating the right things, avoiding sunshine, all these lifestyle factors that are going to really help them. And then what you do is you then build on it gradually. And you can see from the banner behind us that actually when you start building on the diet and lifestyle optimization, you can then optimize their hormones. So we're talking about testosterone replacement for men, we're talking about HRT for women. Following that, you can then optimize weight. And you're sure you've heard about Ozempic, or the GLP-1 and the GIP agonists. All of these treatments can be combined in a way that actually works for patients to optimize their weight. And then you carry on building up. So the next thing is performance optimization. So mental performance, physical performance, supplements and medications that are going to make them go to the gym and perform better, make them perform better in the office mentally. And then ultimately, the top and the pinnacle of the pyramid really is that healthy aging. So how do you take someone who's optimized and continue that for as long as possible? We're not trying to create someone who lives to 150, 200 years. What we're trying to do is give someone a healthy as life as possible for as long as possible. And if we give them an extra decade or so as a circumstance, that's great.
So I think a lot of you said the sound is getting better. How is the sound now? Are we getting a bit more sound coming through? Is it worth swapping the mic over?
I think we're going to swap.
Okay, yeah, we're going to swap the mic over for those that are struggling to hear. I know some of you are saying there's better sound. So one of the questions I want to understand is, so it's a much wider encompassing what I'd call medical landscape when it comes to your patients. It's going to be a mixture of some younger, much older, male, female. It's going to be very much a mix, unlike aesthetics, which kind of the cohort can be very female dominated as well. But when it comes to understanding the term longevity, you mentioned that there are a few different caveats, but weight loss seems to be the one I know and I see a lot in the media. And I watch the CEO and a variety of other ones, and they've got lots of different experts coming in and talking about weight loss and these Ozempic, Wegovy, the options out there. Can we start with that as one of the things to consider? I mean, when it comes to these treatments, I wouldn't know, or I wouldn't feel comfortable being able to prescribe something like Ozempic, or being able to prescribe a battery of blood tests to look at someone who's going through the menopause process, to look at do they need HRT. It's a very large landscape for longevity, and as a business model, I can completely understand it. I've got a cohort of patients in my aesthetic clinic that might want these treatments, and I need to understand how do I cater to their needs. I mean, for me, the most important thing is I don't want them to go off to another clinic that offers everything. Aesthetics, longevity, skin, the works, that's a big business no-no. Should we swap the mics over?
Yeah.
So when it comes to that, who can actually prescribe or get involved? What do you have to be? What do your background have to be? What do you need to do? CQC, tell me all about it.
Yep, so absolutely. So it's very similar to aesthetics. So anyone who can prescribe longevity medicine, okay? And that can be anything from bioidentical hormones, it can be GLP-1 agonists, it can be some higher dose supplements and medications for aging. All of these things can be prescribed as long as you're a prescriber that's registered and you are regulated by some national body. So be it the NMC, be it the GMC, the Pharmaceutical Council, whatever it might be, as long as you have a regulatory body that are overseeing your prescription ability, then you're able to prescribe these treatments. There's also options for non-prescribers. So for people who aren't able to prescribe, they can still recommend certain supplements. They still do consultations, recommendations for diet, lifestyle advice, all these things. And just like we work in the aesthetics industry, that often prescribers will work with non-prescribers to help with Botox, the similar things can be set up in the longevity sector.
I can see that the sound is coming much better. So for those that are tuned in and listening, thank you so much. We've got a lot more to cover to go through things. If there are any specific questions you have, do let us know by dropping a comment into the box. But I would love to know, for those that are joining, who here is from the UK versus where are you from internationally? I'd love to, if you can drop it into the comment, as well as who's already injecting and has a large audience base, and who's new to the sector, who's new to the aesthetic space, or who's new to the longevity space, and what your backgrounds are, just so we can better understand our audience and kind of fine-tune the questions towards you guys. Good, okay. So Abs, tell me about longevity itself. I mean, from a cellular perspective, what are we thinking about?
So the whole point of longevity is that you kind of stop using this sort of typical guideline-based macro view of the patient. You know, if I was just speaking to Gary out there, he said, what is longevity medicine? I think he got it quite quickly. I said, if someone's got a kidney problem, you kind of jump to a drug that deals with that. If someone's got a wrinkle, you jump to Botox. What we do in aesthetics isn't anti-aging, because if we're treating the symptom of aging, they've already aged by the time they see us. Longevity is about understanding on a cellular level what's causing that in the first place to make them come in, so they don't need to come in, rather than waiting for things to get worse and then treating them. So I'll give you a real life case example. If someone leads a typical Western diet, typical Western lifestyle, there's a chance that at some point they may develop diabetes and Alzheimer's. This is just one example. Using knowledge in longevity, you can basically intercept that patient much earlier, change their diet and lifestyle as well as other factors, by understanding the metabolism of what's going on a mitochondrial level, and realize that if you make this change and this one and they stick with it, actually the probability of developing those diseases and those conditions drops as low as possible. And then you can make a change to their life. I'll give you another example. So typically we may think that if you smoke, you get it so many years off your life, probably about 10 years off, depending on which paper you'd like to quote. But actually studies have shown that there are quite a significant number of smokers who still live to 100. Not a huge amount, obviously, but enough to make you think, well, if smoking is bad for you, how are these guys living to 100 and having no problem? And part of that is because when we look at something like the omega index as an example, we find that there are ways to negate the effects. I'm not saying you should smoke, like please don't think that, but there are ways to negate the effects to the point where every single smoker that lives to 100 has exactly the same thing going on inside. I don't have time to get into it here. But if you understand that, if you have that knowledge, then what you can do is implement that in your life and in your patients' lives, so everyone is living healthier and longer, as opposed to just longer for the sake of it, riddled with disease. So that, in essence, is the crux of longevity, understanding what's happening inside the cell, not even on a cellular level or subcellular level, and then using that to make changes so they're less likely to develop any disease and live to as long as possible at the same time.
Okay. Now I might need to borrow one of your mics because there's a big difference in audience. So can I just borrow a mic quickly, just ask a couple more questions?
Pass the
and I'll
mic.
pass it across. Yeah. I mean, bear with us. This is our first one running a longevity webinar. There'll be more to come, and we'll be answering all the questions shortly as well. But a large section of questions I have is a mixture of, we have some pharmacist prescribers, some nurse prescribers, we have a mixture of doctor and other prescribers as well. What about dentists?
Yeah, absolutely.
Included?
Yeah, absolutely. I do it already. Basically, if you have the ability to write a prescription, you can get the insurance to do this. And we've had that in writing from Loctons, who are an insurance provider, and the official line is, not just my opinion, officially, if you can prescribe, you're able to get insured for this.
Okay. Now, one of the interesting questions is, how would one go about learning to be able to prescribe TRT and HRT and these various things? We'll come on to, we've got a big announcement to make at the end of the webinar itself, so do stick around to the end. But someone's asking about CQC. Can we go into a bit more detail about CQC?
Yeah, I think it's a really important question, Amrit, because a lot of people are thinking, well, we're prescribing medications, we're treating disease, we're taking bloods potentially, all these things we need CQC registration for. So there's a couple of different answers. There's a few different options that you have. The first of which is to offer supplements only, and advice and general advice, and outsource any blood tests to a third-party company. And then we work with Randox, who do a lot of our blood testing, and they actually set up everything. So you can request your patient to go into their clinic. They get a full body composition analysis, they get height, weight, BMI, blood pressure, everything there done, as well as the blood test, and then all of that report gets sent to you. So the blood test is taken care of. Then you can go on and actually prescribe sort of supplement regimes, although not necessarily required under CQC. So there are ways to do treatments and to do interventions with people without even needing CQC registration. For those who want to take one step further and start prescribing things like GLP-1 agonists or GIP agonists, or those who want to start prescribing testosterone replacement, then there needs a requirement for the CQC because you're prescribing a medication for a condition. And there's a couple of easy fixes for those. So the one is to actually get practicing privileges. So for example, my clinic works out of a clinic on Harley Street. That clinic is registered with CQC, and therefore I am covered for CQC through my practicing privileges, even if I do online consultations. And the other one is obviously to go through CQC registration, which when you use a third party, actually can be done relatively quick and painlessly, because these third parties set everything up for you.
Can I steal your mic now, Abs, if that's okay? It might be easier. I can get you guys to swap between it because we have questions one at a time. So, okay, so that's really interesting. So, there's people, a lot of these names I recognize in the comments, so it's really nice to have you guys on a webinar, but we've got a mixture of people. There are some people brand new to the area, ENT doctor from Manchester. We have a dentist from Botswana, injecting 8 years, really experienced injector that I met actually not long ago, a UK rehab consultant. Now, one of the questions was, is longevity medicine basically functional medicine, or is this something that we need to think beyond functional medicine?
It's a good question. So I think longevity medicine overarchingly covers lots of different things. So functional medicine is one of those things. So functional medicine, precision medicine, personalized medicine, lifestyle medicine, restorative medicine, all of these types of terms have all been there used for slightly different things. And longevity medicine really brings all of them into one field of medicine. And that field is, as I say, to optimize patients' health so that they don't develop disease, they're living healthier for longer. But it's interesting you talk about a rehab consultant that's watching us, because I know Abs has worked with the director of NAD Plus at home, and there's an interesting story there I think Abs might want to share with us.
Yeah, I've got a lot of data on rehab. So to give you a bit of an example, this is again, real life case study. This is, if you understand longevity medicine, you get into it, this is the sort of thing you'll see and eventually be able to even do yourself possibly. So back in the 90s in the William Hick Clinic in Tijuana in Mexico, people who were on their last legs in terms of alcohol-induced liver toxicity. Because if your liver fails, you fail. You've gone. So the liver was on its last legs. They received IV intravenous infusions of NAD+, which isn't for everyone, by the way. That's one of the things we'll teach. But they did that. Within 5 days, they were up walking around like us, completely fine, no liver pathology whatsoever, and they had no cravings whatsoever as well. So you have to understand how that molecule works, and that's something we go into in Apex. We teach it as well. So rehab is very important to understand the origins of some of these things we see in longevity medicine, because people see nutritional supplements, like NMN, NR. There's some people will say there's benefits, some people they won't. I'm not going to get into that debate here, but it's because I could talk for a long time. Yeah. But when you look at the origins of these things, that those supplements originated because people were taking the direct molecule NAD+ originally, and it was completely getting rid of their liver problems. And to put it into perspective, we've all heard of Alcoholics Anonymous. Bill something, I forgot his last name. His sort of most proud achievement wasn't Alcoholics Anonymous. It was to use essentially what they called back then a vitamin B3, Bravo 3 derivative, which we now know as NAD+. And he even said he cured alcoholism more with that than he did with Alcoholics Anonymous. And it's just the ability to have this knowledge that will change your practice, change what you can treat, who you can treat, what changes you can make to people's lives. And that knowledge is really what we want to try and spread to as many people as possible.
Now, the audience are a bit like me. The business brains are ticking, their clinician brains are ticking, and the questions are really, really great. I mean, if you have any questions, do drop them in the comment. It's amazing to see the comments coming through. They are really phenomenal comments. And as you can see, they are very much experts in the area. They really know. I want to dig into their brains a little bit more and understand what is actually the treatment options and how we can learn this. But this is a common question. And this is me as an injector asking a similar question to what the audience is asking. Is there a specific certification required? How do we go about learning this in itself? Because as an injector, to learn a new procedure, we're thinking is about, I need to do a training course, I need to learn this. How do we gain the knowledge, and what would be required from a physician or a clinician's perspective to be able to feel confident in then being able to engage with real patients and turn it into a business?
It's a good question, and it's a question that's on everyone's mind, because we often we see all these longevity treatments on Instagram, on socials, and we see all of these things that people are offering, and we sort of think, wow, it's such a wide field, how do I even make a start? Yeah. And I actually reflect back to 15 years ago when I started doing aesthetics, and I was thinking the same thing. I was looking at people doing all of these sort of like higher level treatments, and I was thinking, wow, how do I start doing that? And I think particularly for the aesthetic audience, you're not going to start by doing a full face transformation. Okay,
yes, that's true.
What you're going to start with is you're going to start with the building blocks. Okay, and what you've got to start with is you've got to start with optimizing hormones. You've got to start with optimizing weight. You've got to build up.
I wouldn't even know what the beginning or the foundation of this really is, right? I mean, It's when you come on an aesthetic course, you expect them to tell you what a foundation procedure is.
Exactly right. And we're going to talk more about this towards the end of this webinar. But essentially, what you need to do is you need a foundation into longevity medicine. You need to understand the building blocks. Longevity medicine is like a giant jigsaw puzzle, and you need to know all of the pieces and where they are and where they fit together, and you just need an idea of what the picture is and what the landscape is. Once you have those building blocks known and doing those sort of initial training to understand the fundamentals of longevity medicine, then you can really dive quite deep into some of the niches that really are fascinating, that change the composition on a genetic level. And we're talking about DNA both in our own genome, but also DNA in mitochondria, DNA in the gut flora. You can actually start biohacking and modifying these types of things on a really high level and completely transforming people's lives, just like a facial transformation that you do in aesthetics.
So I'm about to call myself a biohacker.
Exactly right.
So before I kind of dig in a little bit more to understand the sort of academic side and some of the theory, let me think of it as a business model. So I mean, a lot of people are asking, they already have CQC registration. Some are saying, can I offer this remotely? And I think absolutely, if you can work with a clinic that has CQC registration and you can get practicing privileges, like you mentioned on some of the clinics where you're renting premises within that clinic, you should be able to offer this as a remote service almost, isn't it? By doing some online consults and virtual consults.
It's one of the really big benefits. And I know, Abs, you travel a lot as well, don't you? So actually the fact that, I mean, I have 2 small children. I quite like doing my virtual consults in the evening. I think it's fantastic. We put the kids to bed and I can do 2 or 3 hours of virtual consultations. You know, I have a wife that works too. So actually, you know, you can't always have an evening clinics where you're doing aesthetics. So it complements aesthetics fantastically well by offering these virtual consults. So you can sort of do wherever you are really. So yes, virtual consults are a really key part of longevity. And I know you have some experience with that too, Abs.
Yeah, I do that quite a lot. I mean, if I did a video recently where I was treating England captain Michael Vaughan, cricket team, and you know we work remotely, so it's very, very easy to do. And because I travel a lot as well, so like I mean I've been in, I don't know, probably 4 countries in the past 2 weeks. Like I'm knackered, but I could still carry on working. Things you kind of need to do in person is, let's say you're demonstrating something, if patients really want to see you in person, but you know once you've prescribed, there's no absolute requirement to have the patient sat in front of you.
Okay. I can attest to Abs' jet lag. He almost turned up here at 6:30 this morning.
Okay, wow. Yeah, I mean, Abs in a different country every day. So I mean, there are some really technical questions that people are asking. I will ask one because I want to in a moment. But I want to follow on from where we were so far before I get into the technical side. So you've got a cohort of patients, or you can advertise this service. You're able to offer it remotely, provided that you have the CQC, or you can go down the non-CQC by doing the supplementation as well. And then of course, you've got your patient. They present with some usual concern or goal or outcome. There are options to then do external blood testing. You get the results. You need to understand the results. You need to understand the consultation. You need to understand the science to be able to then make some form of diagnosis or recommendations. You then create, I'm guessing, a treatment plan for the patient. And the patient will then purchase some sort of prescription or supplementation from you, but that is not going to be like having a Botox or a filler treatment that lasts 2 or 3 years. I'm guessing that there's going to be potential for repeat business from this repeat prescription service.
Yeah, absolutely right. And one of the great things about longevity medicine is most of it is subscription based. So most of my patients are on some form of subscription where they pay at my clinic monthly for a regular service, and that's on a different tiers. They might start off with a basic subscription, which is just for test review service, prescriptions, and that sort of thing. Or it could be a completely top tier where they see our nutritionists, our personal trainers, our life coaches, myself, regularly.
Improving the quality of someone's life. So it can be quite rewarding, I'm guessing.
Yeah, absolutely. And I think certainly when I was in aesthetics, and this pains me as a plastic surgeon to say, but I always felt that something was missing. I always felt that I wasn't quite treating the patient to the best that I could. And that's why I sort of really took a bit of time off of aesthetics to really concentrate on looking at the research, looking at the evidence, to try and really create something within longevity whereby actually you can really optimize their health and their well-being and really give something back to them. And it's so rewarding having them come back after they've lost 10 kilos, 20 kilos. But not only that, but keeping that weight off, optimizing them to the point where you're not just using a GLP-1 agonist just to lose weight drastically and then put it back on when they stop, but actually you're optimizing their lifestyle using a GLP-1 agonist to actually can make changes at the base level where they can continue that after they've stopped medication.
And I mean, to me, some of these terms, biohacking, GLP-1 agonists, GIP agonists, HRT, TRT, all of these things to me just sound like some words and letters, right?
Just made them up.
Basically, right? So I'm guessing to actually understand them would require some degree of training, which we're going to come on to shortly. But can I get into one of the technical questions? I mean, there's some really interesting ones. The audience seem quite clued up on some of these things.
Because I've always passed the mic to me already when it comes to the technical stuff.
So, I mean, GLP-1 injectables or tablets, any evidence on efficacy or related to longevity? What do you reckon?
I think Matt can easily answer this as well. I think you can do both. That is something we teach on the course. And
just for those that don't know, GLP injectables versus tablets, we're talking weight loss here, right?
Yeah, so glucagon-like peptide. So they are used in weight loss. Originally they were used actually for diabetes patients, which is why there was a big shortage in the UK because they were being used for other things. You can use injectables, you can use tablets, there are multiple different ways. And part of what we teach you on the course is understand the risks and benefits of each one and then trying to figure out which balance between risk and benefit is right for that individual patient. So it's a good question. Unfortunately, the answer is very long, hence why it's in the course and not something we can answer straight away. But it's absolutely the sort of thing that we go into. I don't know if Matt wants to add anything at all.
No, I think you covered everything there, Abs, and I think it's really key to note there are so many different types of treatments that you can offer, and Ozempic is a diabetic medication, and you've seen Wegovy and Mounjaro and some of the newer GIP agonists which are having better outcomes with less side effects.
So I remember there was a shortage of Ozempic at some point in the UK, internationally.
Exactly as Ab said, because and it was a real issue because diabetics weren't getting their medications, and because people were using it for weight loss, which is why the medication is now split off the different doses. So Wegovy is essentially Ozempic but at different doses, and then newer medications have come out, such as these GIP agonists as well, which again we can talk more about in more detail. It's a very, very complex area, but it's easy to translate into clinical practice.
For many of you watching, I know a lot of you are asking, will this be recorded? This will be recorded, and this will be available and emailed to you as a link to rewatch at your own time. This link should still remain open or accessible after the actual talk itself. NMC registered, can remote prescribe or cannot? How would the remote prescribing side work? Is there some rules around that? And also, where would they take this prescription? Some people are asking about the supplement prescriptions or the prescriptions that you're going to give. How do they access these drugs?
Yeah. So NMC prescribers, so nurse prescribers, can prescribe these remotely, absolutely no problem. It's not like Botox that you have to prescribe in person. So that makes it a lot easier for people who don't prescribe, who might want to partner up with someone who does prescribe. And actually, it works really well in a clinic. If you are seeing a lot of longevity patients, you can actually outsource some things to non-prescribers to actually do those initial consults, find out, spend that time with them, develop that rapport, and really get to the bottom of why they're in the situation they're in and what we can do to optimize them. And then you can have a prescriber sign off on any prescription plans. As for getting hold of these medications, we work with partners across the field, and we've tested these, and I've tested these over the last 5 years. And we know a few prescribers, pharmacies that will work really well to actually issue these medications in a very seamless manner, and they're set up for teleconsults. So they are set up for you to do your teleconsult, prescribe remotely, and then the medication just gets shipped straight to the patient, and either they bill the patient or they bill you, and you can work it out. But it actually works quite well if they bill you, because you get charged the wholesale price, patient gets charged at RRP, and the pharmacy tend to reimburse you the difference. So that's another source of passive income for the clinic.
Okay. I mean, it sounds like a very much a viable business venture for someone who's already got a setup, who's already looking to get going and adding a service. What's the market like? I mean, patient awareness seems to be growing in this. There's articles and papers and social media everywhere flooding this sector. And I've actually already noticed it in my clinic. I've already got patients asking me, but what is the market like?
I mean, I think the market is always there, because technically what you're asking is, what is the market for people that want to be disease-free and live as healthy as possible? So technically that is actually everyone. It's the knowledge that is not necessarily there, because a lot of people's mentality is, if they've got this problem, they have to take this drug. They're not aware that there's other options out there. So for instance, I'll give you one specific example. Once you go deep into longevity and you have knowledge about what's happening on a really, really deep scale, which won't be straight away, by the way, it takes time to learn, just like it takes time to master injecting. Let's say, I've consulted on cases where, I've had like 2-year-olds with second-degree burns in intensive care. Now, that's nothing to do with aesthetics, but because of the knowledge gained from things like longevity, looking at mitochondrial function, looking at the way, I won't get too technical, but there's things I will need to rein myself in on. But looking at those sort of things, we accelerated those healings to be sort of 4 weeks, secondary burns completely gone. There was one guy in Australia I consulted with, his leg was due to be amputated for diabetic gangrene. After just a few weeks, I managed to get blood flow back in, and now his leg is up to, and he's walking around fine, like he's not in a wheelchair anymore. Once you really get into longevity, you realize actually that market is everyone. And what you can do is extraordinary. But please don't think that on day one you're going to learn how to do those things. That's the sort of thing you will eventually build up to.
Just something to quickly add there, Amrit, is when I was doing aesthetics, you're at a party or you're at a social gathering, you talk to people about doing aesthetics, and I always found it was about 50-50. 50-50 people were like, oh great, can I come and have my Botox done with you? 50% were like, oh hang on a minute, what are you doing?
10 years ago, it was not 50, it was less.
It was 1910, yeah.
Now it's probably 50-50, but it was less. And I think that's where maybe even longevity is today. It's at the beginning of this huge surge where maybe in 5-10 years from now, everyone will be offering it. But for the early adopters, is the time.
It's the perfect time. And what I will say to you is, when you start offering these services, When you talk to people at a social gathering about the fact that you are working to improve healthy life and healthy lifespan, you are suddenly the center of the party. Everyone wants to talk to you. Everyone wants to find out more how they can perform better in the gym, how they can perform better at work, how can they lose that weight, how can they deal with menopause, andropause. They want to know all of these things. And the amount of patients I've signed up as clinic patients just from talking to them at social gatherings. And it is something that I would say almost 100% of people are interested in hearing more about when you start talking about.
So, I mean, I can't hold them back any longer. They're not being patient enough. They want to know about the course. Right. They want to know on how do they learn more. Tell us about your course. I mean, they're reading your minds.
Okay, we made it to the second half at least, so that's not too bad. Right, so the last 2 years we've been working behind the scenes on creating courses for people to learn longevity medicine. Now, obviously, having worked with Derma Medical for 7 years and sort of growing alongside yourself and growing the company, rewriting courses, we've taken a lot of the learning points from how you learn to do aesthetics. And that doesn't mean that you can only do longevity medicine if you do aesthetics, but it just means that we're going to take the same approach to longevity medicine to do aesthetics. So we're not going to go straight in and teach you how to do a full face transformation. All right, we're not going to teach you how to completely and utterly rejuvenate someone's lives. What we're going to go in is teach you those building blocks. So we're really proud to mention that we're already launching our courses for foundation medicine. So we're going to be launching our foundation and our advanced courses in longevity medicine, and these are going to cover everything that you see here on the poster. So this is going to cover your diet and lifestyle optimization, hormone optimization, which is all about testosterone replacement and HRT. It's also going to cover the weight loss treatments that we've talked about, the GIP-1 agonists, the GLP-1 agonists, and other adjuncts to help maintain that weight once people have lost them. We're also going to go into biohacking, how you can optimize yourself at a cellular level to perform better both mentally and physically. And finally, we're going to tell you about how you can take patients and completely make them healthier for longer by reducing the risk of diseases like cancer, dementia, and so forth. And all of that is going to be covered in our foundation and advanced courses, and that's going to be open to anyone. So it will take someone who has no experience of longevity medicine whatsoever, and it will guide them all the way through to be able to offer all of those treatments that I've just mentioned, and just by doing our foundation and advanced courses.
I just want to add in, this course is being taught by people who don't have anything to sell. We're not trying to sell a particular supplement or any kind of IV treatment or anything like that. So there's no bias towards any kind of product or pharmacy or anything like that on there. As well as that, it's not just theory. Like on the course, there are real live patients who are wanting this type of consult, and myself and Matt will be there. We talk to the patient, you talk to the patient with us there, and then we discuss what's going on. The patient knows you're all learning, and that's very unique. Like instead of just having a theory of, oh, this is the hormone you prescribe, there's a real life patient with real life budget issues and constraints for you to sort of customize things for. And as well as that, it's being taught, for myself as an example, I've been there on the receiving end of the very, very latest innovations in clinical research. I'm part of a team now where we've literally managed to achieve the self-destruction of cancer with simultaneous strengthening of the surrounding eukaryotic cells. Now, this is very, very advanced, and this is stuff that I do in the lab. I do in Italy a lot, and I'm bringing that kind of depth of knowledge to everyone else, basically. So it's not just someone who listens to a lot of podcasts. It's a team who have been there and done it all, and are still at the forefront of things, answering questions we have no answers to. And so it's at the latest sort of cutting edge of longevity medicine in terms of the latest knowledge and the most up-to-date knowledge.
And I think that's a really key point, Abs, is that we aren't trying to sell anything. We are really, both of us, passionate about more and more people getting into longevity medicine. As I say, I wasn't fulfilled enough doing the aesthetics. I wanted to really change people on the inside, really optimize people's health. And we are just really passionate about helping medical professionals to do that. So we've gone really down to the grassroots. I've spent the last 2 years researching I think I've won PubMed. I think I've suddenly somehow read the majority of PubMed to find the latest evidence. So rather than just listening to all the marketing that's out there, some certain companies who claim this or claim that, all the snake oil that you hear about, actually going to the scientific evidence and looking at studies that are in humans. Okay, we're not looking at things that might prolong the lifespan of a yeast for 25%. We're looking at real effects in human beings, and we're taking that and we're transforming that into a clinical practice, into a clinical situation. And you know, you run all of the derma courses, and you know how the main aim of derma medical is to transfer sort of scientific knowledge about the injections, the landmark-based techniques, transforming that into how you give a good result. And we've done exactly the same. We've taken all the high-level science that Abs has talked about, and we're making that available to any medical professional to understand and implement into their clinical practice to optimize patient outcomes, but also generate profit for their current clinic.
So I know we've got about 20 minutes to go, and I want to cover as much as I can. So drop any questions that you have. I know they're all just coming in. I'm going to start going into a few things. These are the kind of questions I'm going to go into in a moment, just so you know. But I'm going to talk a little bit about the marketing side. But I've got some questions asking to talk a bit more about TRT. I've got someone asking me to go into a little bit more about hyperbaric oxygen, which I want the Abs to kind of show off his hyperbaric oxygen knowledge in a moment. But before we get Abs to go into that, I mean, you can see how keen he's ready. He's ready. I want to talk about, for those, there's quite a few people here that are saying they're already CQC registered, they're already doing what you recommend. How do they get their clients? Their marketing is awful. I mean, this is where it comes to understanding and how the power of harnessing marketing, because not only will the courses kind of cover about the scientific backgrounds, right? There's going to be an element on how do you market and explain, turn this into a business, because it's useless taking something such as the knowledge that Abs has, but then not understanding the second half, which is how to turn that into a business, how do you get your clients, and that really comes down to how you market. So for those that already have a business in aesthetics, you already have an email database of paying customers having injectable treatments who no doubt will be intrigued to have a discussion at their next treatment or to book in for a consultation to learn more. They may already be struggling on an NHS waiting list to be seen by a specialist for a certain condition or whatever, and they may just want to go ahead and book in with someone to extend their the biohacking side, to improve their performance and their mental performance at work or their career or various other things. So when it comes to understanding who to market to, you've already got a database if you're an aesthetic injector. But for those that aren't, we're looking at then essentially understanding how to set up a website, how to promote yourself as a service, how to really promote yourself as then a trained expert in this field. And that's very much the case. I think there aren't very many experts in this field. It's such a niche and newly growing field. I absolutely see in 5 or 10 years' time, there will be various experts that are Instagram influencers in the space. But at the moment, there doesn't really seem to be anyone, isn't there?
No, exactly right. And I think it is a space that is so ready for the taking by the first few people that get into this space. And I've certainly noticed by running my own longevity clinic that there's not a lot of competition out there.
Yeah.
And people are just surprised to hear about it. And once they hear about it, I'm not competing with anyone else really. It's just they're coming to my clinic and saying, this is great, I'll sign me up. So yeah, absolutely. You can really target these patients. If you say you've already got a marketing database, you've already got a marketing database, there's the same age-old question of how do you set up. It's exactly the same for aesthetics, isn't it? It's how do you get those first few patients through the door? And the answer's the same. It's reaching out to friends, family, it's talking to people at these social events, it's getting their testimonials on social media. So you can't put your befores and afters obviously on. You might be able to after a year or so when they've transformed their body in their houses, but actually you can't just give it an easy result. But a video testimonial from a patient who's been seeing you is a fantastic idea. And we actually, and you obviously run your business boot camp, which if you haven't attended, highly recommend. Fantastic way of getting into aesthetics and boosting your aesthetic marketing. But we're planning on doing the same thing for longevity to really target that for longevity practitioners to really get an idea of how to market themselves.
Now, someone made a comment when I talked about Abs is going to be explained. Someone said it'll be longer than 20 minutes once Abs gets into his element.
You guys know,
They do. From a business point of view, what treatment and consultation, how much does it cost a patient to come in for a consultation or for blood tests? Where are the margins from a business point? What are you going to make roughly? What can they anticipate to charge someone?
So I charge £250 for a 45-minute consult. which I do from the comfort of my own home in the evenings. I can do 3 or 4 consults in an evening. So the margins are there just for a consult and just for giving advice alone. So it's not like aesthetics where you might charge a fee for a consult, but you normally deduct that from your treatment. But it's not the same. So you're very much you're bringing someone in because you're giving them diet and lifestyle advice already. You're already starting that treatment plan in that initial consultation. It's much more like a surgical consult or a medical consultation when you're going and seeing a private GP. So it's you're already getting margins that way. Then you're sort of getting them interested in blood tests. Now, blood tests, again, are charged to the clinic at a wholesale price and to the patient at an RRP, so there's always a margin there. Supplements come with a margin, and we work with partners that actually offer kickbacks to providers and to prescribers who use their services. So any patient they send to them for their supplements, they then get a bit of a kickback from it. So there's always margins coming there. And you might tell from what I'm saying is there's a lot of passive income here. So a lot of this is actually not requiring you to be there injecting patients, which is what aesthetics does.
So a lot of you have been asking a little bit more about how they can get some information about longevity. And if you're new to it, where do we start? I mean, I'd recommend the training course that Matt and Abs have put together. I've seen the slides. They look phenomenal. I mean, when I started scrolling through them, I could have lost hours. I had to stop and go back to work before I'd love to attend the first course. But there's a link in the comments at the moment where you can register your interest for the courses. It's apexmedicalacademy.co.uk. Have a look. Register interest, you'll be the first to hear about it because it's one not to be missed. So let's get into it, Abs. Hyperbaric oxygen.
Anyone got a timer?
I mean, as an aesthetic individual, that's the last thing I want to learn about because I'm sending a patient with necrosis there usually, right? So but what are the benefits?
So before I answer, I just want to say, like, the knowledge I'm going to give you, this is not what you get in the foundation. This is what you start with in order to understand this knowledge. So we've got the foundation, we've got the advanced. We've got some masterclass on individual areas like menopause, TRT, etc. And then after that, we're going to have a really intense sort of ultimate masterclass, which will probably be about 2 days of me taking about 3 breaths before across the whole 2 days. But that's the level that this kind of stuff would be in. So to understand hyperbaric oxygen, you have to understand that every cell in any eukaryotic system has the ability to either burn, you metabolize, or to grow, to store things. Every cell is always in that decision-making process. Do I grow or do I burn? Now, we have to look at what happens in terms of cellular growth. So it's at the moment we are a zygote, after we're in the womb, we start to grow. We start to double the number of cells, 1 to 2, 2 to 4, and so on and so forth. How many times would you think the number of cells doubles for a human being in their lifespan?
Does it depend on the cell?
No. As in the total number of cells. So we start off obviously as a single cell.
Right, I see.
And then we double to 2, we double to 4, we double to 8.
As an adult?
By the time you die, yeah. So a typical lifespan.
I'm guessing I know skin kind of turns over every 28 days and your bones kind of turn over every few weeks and everything. It depends on what looking at turnover, right?
So the total cells doubles probably about 41 times.
Okay.
35, I think, is around in utero. And then 6 is basically once you leave the uterus. Now, the reason for that, if we look at our O2 sats now as we're sat here, it will be about 98. When we look in utero, the O2 sats are around 30. What would you reckon the O2 sats of cancer are?
I mean, I imagine it's very highly metabolic, right? So it must be quite high?
It's around 40 or 44, so it's very low. So what we find is oxygen stunts growth. So when we have very low oxygen in the uterus, we double the number of our total cells of us as an organism 35 times. It's only 6. The moment we leave the uterus and we take our first breath, suddenly we go from growing to burning. So we change. And so when you look at cancer, it grows because it is lacking oxygen. That's why cancer is not a genetic problem, it's a metabolic problem. That's how we've managed to make it destroy itself without using any chemo or drugs. So when we oxygen in there, we change the metabolism. That's why New England Journal of Medicine, 1951, front page, Mount Everest in utero.
I just want to say, when do I move to Everest? I mean, I worked in the vascular surgery as one of my house jobs, and the professor I worked under as a consultant, he did lots of studies in Everest, doing EVGs on Everest summit and at various base camps and seeing the PO2 levels. And it was phenomenal at what kind of PO2 the body can sort of survive on Everest.
Exactly. And when you understand that, the natural question will be, well, if cancer grows because it has very low oxygen levels, what happens when you're surrounded with oxygen? That's hyperbaric oxygen therapy. So we are trying to increase the partial pressure of oxygen in order to change the metabolism of what's going on. So cancer is metabolic, okay? It's not genetic. If you look at studies like McKinnon 1969, Mintz 1975, Caparetti 2013, you take the genes which are already switched on, so-called cancer genes, which don't exist, by the way. You take the nucleus of a cancer cell, i.e. the cause, if you're saying it's genetic, the cause is in the nucleus, the genes, you put it into a normal cell. If the genes are switched on, the cancer would spread. But what happens? Nothing. Because the mitochondria are not cancer mitochondria. They are metabolizing normally. They are using respiration instead of fermentation. And so hyperbaric oxygen therapy is something that intervenes along this whole, I know I've talked about different things, but it paints how
do I take it for life? What is it? Who is it for? What are the benefits? Why should we be considering offering this service?
So I'll start, but I have a feeling you might supersede me in the knowledge of TRT. But so with my patients, we are really looking to optimize testosterone levels. So as soon as you hit 30, your testosterone levels really start declining, and there's quite a high proportion of people who actually have low testosterone. So, for example, our generation has a lot lower testosterone than our father's generation. Yeah. Or our grandfather's generation. And it's an environmental thing that things to be changing that's really lowering testosterone levels. Okay.
Can we repeat the last couple of minutes? Because I think the stream crashed for the viewers.
Oh, yeah, of course, yeah.
You mean during Abs's monologue?
That's probably a good thing.
So just to repeat, because I think we're going to do other webinars. We're going to go into different specific topics so we can understand a little bit more about what some of them might entail. I mean, weight loss is a huge one that a lot of people would want to know about. Some of them are prescribing pharmacists. They want to know a bit more about what kind of questions they need to consider asking the patient, all sorts of things. Someone's asking about, does hyperbaric chamber work for Alzheimer's? And there are lots of questions about Alzheimer's as well, so specific. Yeah. But the question I was just asking was about TRT, testosterone replacement therapy. Quite a lot of you asked about that in particular. Who does it for? Who does it benefit? And I think the science that Matt mentions out there is that the testosterone levels historically to now have fallen for whatever age group you're representing. You generally have less testosterone today than your equivalent age group person would have had 50 years ago.
The previous generation, exactly right. Yeah. So your testosterone is a lot lower, and our testosterone is getting lower as we get older. So testosterone is something that is worth checking. A low testosterone can be associated with lots of different symptoms, and symptoms that people don't necessarily associate with it. So things like low libido is obviously very well known, but also mood changes, insomnia, all of these issues can actually be associated with low testosterone. So by checking your testosterone levels and optimizing that, either through transdermal applications or through injections, it's a really, really good opportunity to both treat these symptoms, but also one of the main reasons to do it is actually to help reduce fat. So you're burning fat and you're putting on muscle, and you're combating things like sarcopenia, because as we get older, our muscles will waste. And actually by optimizing testosterone, you can protect against that to quite a high extent. There's more that you can do. This is sort of what we teach in our foundation course. But there's more that you can do to even go with super therapeutic levels of testosterone in a safe and controlled way to really go into the biohacking territory where you can really, really increase the gains that you've got in the gym in a safe manner without becoming, the Hulk and going into void rage and so forth.
And when it comes to these things, I mean, I'm guessing. So I've seen lots of people kind of talking about their. I mean, patients are now saying they actually know their testosterone level. I've actually had a few that I've seen, and they said mine's 200, mine's 300. It's really low, and I'm trying to improve it. And they're talking about hypercortisolemia, the fact that we're now living more stressful lives, and the constant exposure to the cortisol levels that we now get seem to be suppressing our gonadal response. So how would you go about a patient, right? Let's go through a scenario, for example. What would it, as a business owner, I've got a customer and they're asking me, I'm injecting their fillers and whatever not, and they're talking to me about that they want to gain some muscle, or they've got some big event coming up, or they've got some of the symptoms, loss of libido, whatever. How can that be something that I can incorporate into a consultation to kind of dig in more? Is there any, I've not consulted a patient outside of aesthetics for years now. Would we need to learn and understand what specific symptoms we're looking out for? How does it all work?
Yes. So we cover a lot of this in the course. I can't really cover it in the next sort of 5 minutes.
No, absolutely,
but it is there are specific questions you need to ask. There are specific risk factors you need to address. But what I would say is what you want to do if you're injecting that patient. What you want to do is say, look, come and see me for a longevity consultation. Don't try and do it middle of injections or doing something else. Okay, make it a dedicated 45 minutes.
I mean, they bleed. I could just take that sample.
So we bring them in for a proper consultation and start from the bottom up and really optimize them. So you might have people who want to come in for biohacking in our sort of 4th level, but actually if they haven't optimized themselves up to that point, then biohacking is going to do absolutely nothing. So they need to get them in for a longevity consultation. You need to look at them, you need to talk to them, find out where they are and what they're dealing with. Then you need to do blood testing. Okay, so then you send them off. You either do blood testing in your own clinic. You can send them off to have your blood test done.
There's actually someone with a lab in the comment section saying that they'd like to partner with us. But
fantastic!
Yeah.
Drop us a DM. But yeah, so then you go on and then you have your another consult with your lab results, and then you can start implementing plans, and then you get them to come back regularly so you can see them in your clinic.
So with that, so I can understand it a little bit more clearly. So you'd almost kind of have 2 arms then, isn't it? You'd have your aesthetic business and then you have your longevity business, and you're a longevity practitioner almost, isn't it?
Yeah, absolutely. You do the same as well. You have both, and I keep mine very separate, and I sort of have my aesthetics and say, well, look, come and see me for a longevity consult, or, you know, I already know you, we don't need to see each other in person, why don't we do a virtual consultation and we can have a designated hour to actually talk about these sorts of things. How do you do it?
So I don't keep them separate. I just say, if you want a consultation, come and see me and we'll talk about your whole life, and we'll look at everything. We'll look at their skin, their chronic diseases, the way they look, because, you know, injectables, everything all at the same time. So as soon as I see anything in the medical history, I say, well, okay, do you want to talk about that as well? Because there are options for that. If I see, and they've got no medical history, but they're pretty healthy, I say, oh, you probably go to the gym, you probably do a lot of sport. I say, well, do you want to, you know, I treat, you know, Premiership footballers, England teams or whatever. Do you want me to share some of the stuff I'd share with them with you? And, you know, they've got that interest. So for me, I personally don't separate it, because for me, I'm a weird person, as you all probably know by now, but for me, it is the same thing. Like a wrinkle and Alzheimer's are the same thing. It is just a disruption to mitochondrial function. So, but that's just my perspective. I think everyone would see it probably the opposite of me.
I think the key thing is you just got to have the time to talk with them. And so you know sometimes in our aesthetic clinics where you're seeing patients every 20 minutes, half an hour.
Waiting room is full of people.
Exactly. Yeah. It's hard to do it, but you can certainly open up a dialogue about these sort of things.
So for those that just recently, I've got a few of you just recently joined us about the course information. I'm just going to get the team to drop in a link to both our social media as well as also to the course registration page so you can learn more. But just remind me what the course is going to cover, because there's a few people talking about different types of testosterone replacement available, NHS versus non-NHS, as well as also different types of HRT available, bioidentical, non-bio. I mean, what will the course kind of cover? And also a really important question is, going from somewhere like where I am, no understanding of longevity, being in the injecting game for a number of years, but almost kind of de-skilled in very other areas as a doctor, how long would it take me to kind of feel comfortable starting to get going in this area? And what kind of I know you mentioned foundation, advanced, a few masterclasses. Where would you recommend? Are we talking years of training, or are we talking a few specific days to kind of get going and then you build on it and you add on another and add on another?
I think the key thing here is that it doesn't take years of training. So, you know, I talked to my obs and gynae colleagues who treat menopause patients, for example, but they actually only cover menopause for around a couple of weeks in their syllabus. So the actual coverage of menopause is quite poor. And what we've done is we've distilled it down into these 2 courses that should give you everything you need to go away and actually start practicing as soon as you've completed them. We also have the option of attending live sessions with myself and Dr Abs, whereby we can actually consult patients together so that you can have experience consulting with patients, giving them treatment plans, analysing blood results. And you can do these live sessions as much as you want until you feel comfortable that you've done enough with us so that you can go away and do it on your own.
I think that's the thing that for me is really unique. It's not just the theory. I know the timing, I know it's quite tight, but I know the theory is very important to understand, and you wouldn't feel confident without the theory and the knowledge. But it's also seeing how you then take it with the actual live consultations with patients, and that's part of the training, right? The fact that we're gonna get to understand and see experts in action, to see you actually take that theory then and adopt it into clinical practice. And we're going to get to learn from you your tips and tricks as well.
Absolutely, but just like on Derm Medical, we don't do much of the consultations. We might give them a demo to begin with, but actually as a student, as a medical professional, you guys are going to be the ones coming onto these courses and doing the consultations with the supervision of Dr Abs and myself, so that we can guide you to do it rather than us just taking over and doing it ourselves.
So I know we're tight for time. We've already run over. Just wanted to, I mean, it was a very interesting webinar, and I'm sorry about the sound at the beginning, and sorry about some of the technical challenges. It's very much a learning game when we do these new webinars, and for those that join the Derma Hub webinars, that's how it was in the first one, but you can see how slick we've become. We're going to do some more. We're going to talk about some interesting topics. I want Abs to have more than 20 minutes to just blow our minds away. But drop into the comments what kind of things you'd like to talk, like Abs and Matt to talk about in the next webinar, and you'll keep an eye on your inboxes and you'll get an email about the future webinars. Yeah. But tell me about some of the topics you're thinking about.
Absolutely. So a lot of these topics you've talked about, we really want to go into more detail. So hyperbaric oxygen, NAD+, NMN, NR, and that entire axis, the vitamin B3 axis, and how we can target that to really optimize patients' health. We also want to look at different types of hormone replacement. I want to go into more detail and explain the difference between bioidentical, body identical, and synthetic hormones. So it's really, we want to listen to you guys. So tell us in the comments, tell us on socials, what do you want to hear more about? We're going to have our next webinar likely to be in June, and we're very happy to see what's out there, what you guys want to learn more about, and we'll get together again and we'll talk to you more about that. But in the meantime, please do go over to our website if you're interested in our courses. Look onto our course registration page. There is a special offer for the first 100 people that sign up and register their interest in our courses. So there will be a nice surprise dropping into your inbox when the courses launch if you are in those first 100. So do get over there, and hopefully we'll see you all soon.
Thank you very much. Thank you everyone for joining. Follow the Instagram channels, Apex Medical Academy, as well as following us via the website for Apex Medical Academy training. As you've seen in the comment section, click on those, register your interest, and look forward to seeing you on the next webinar.
I've got a YouTube channel as well.
Dr. Abs.